So, my younger brother is an attorney, and he often talks about the delivery of healthcare, regardless of where healthcare is delivered. And I appreciate that, right? And I think there's an important sort of context to be learned from that because his point is it doesn't matter if healthcare is delivered in a hospital, an ambulatory surgery center, or frankly, a bloodmobile, right? Healthcare is healthcare, and air is air. And so when our patients come in, whether they're in the emergency department, the operating room, the outpatient, GI lab, it doesn't matter. Their expectation is the air that they're breathing, right, and inhaling is going to be safe. And I think the same thing is true for our actual caregivers too, right? No one goes to a healthcare setting and says, oh my gosh, the air is probably bad. They all assume that the air is good and probably assume that the air is, in some cases, patients even refer to the air as sterile, which is certainly not true. But our goal is to have safe and sanitary air that all of us can breathe and inhale without any risk. And whether that's during a surgical procedure when smoke's being produced or formaldehyde, or in simple context environments like an intensive care setting where a patient just might be on isolation precautions, right? We can't ever say it's only for high risk patients, or we can't say it's only for particular patients. It needs to be continuously done. And that really creates a universal standard of care, which is important. And it also ensures that all patients, all caregivers are going to be exposed to the highest levels of evidence based care for air decontamination.